All right, back in this country, the coronavirus and the federal government's response dominated last night's presidential debate. Former Vice President Joe Biden and Senator Bernie Sanders stood at a noticeably safe distance from one another, about 6 feet, as they argued about why they would be the best person to lead the country in a crisis. Ed O'Keefe reports from Washington.
This is bigger than any one of us.
In their first one-on-one debate, Joe Biden and Bernie Sanders agreed they would respond to the coronavirus better than President Trump.
He is undermining the doctors and the scientists who are trying to help the American people. It is unacceptable for him to be blabbering with unfactual information which is confusing the general public.
But they disagreed about whether a government-run health care plan should be part of the solution.
You have a single-payer system in Italy. It doesn't work there.
One of the reasons that we are unprepared and have been unprepared is we don't have a system. We got thousands of private insurance plans. That is not a system that is prepared to provide health care to all people.
That has nothing to do when you're in a national crisis. The national crisis says we're responding. It's all free. You don't have to pay for a thing. That has nothing to do with whether or not you have an insurance policy.
Both in their late 70s, the candidates were asked what they're doing to stay healthy.
I am very careful about the people I am interacting with. I'm using a lot of soap and hand sanitizers.
I do not shake hands any longer. I do not engage. We did the same thing. Our staff is all working from home. We are not doing rallies any longer.
And on the topic of a vice presidential pick, Sanders said he would likely pick a woman, while Biden made a firm commitment.
There are a number of women who are qualified to be president tomorrow. I would pick a woman to be my vice president.
Ed O'Keefe, CBS News, Washington.
Made news. It was a very civilized conversation.
Yes, no audience.
It really was.